Good evening. This is United Medical ACO. My name is Kamal Arkan. Today is September 23rd, 7 p.m. Our diabetes program Wednesday wellness webinar series that we are starting now. I will be sharing my screen so then everyone can follow me. And here we are. Okay. So the wellness program team, again, I'm the chairman of United Medical ACO. I'm in these events more like the moderator, and then Amy Wilcoxon is actually the program director from the dietitian standpoint, and she should be getting so much credit for this, but I'm opening up these presentations. So, and then we had Donna Dunkel, our Director of Clinical Integration at United Medical ACO. Dr. Ripu Handal is our endocrinologist, and he's the MD, Medical Director of the program from the physician standpoint. And we have our physical therapists, Tim McCoo and Jackie Tomasati as the social worker. Tonight we are going to have two panelists, Amy Wilcoxon and Dr. Gary Singh. So today is one of those good lucky days. Actually, I was off most of today, but I had two live events. One of them was with Dr. Irgam from Cleans, and the other one was with Gary, and then they're sort of my probably most favorite people. So it's a lucky day. So Amy, if you can please take over from here.
Okay, thank you for joining our Wednesday webinars. Thank you, Dr. Singh, for joining us tonight. So every week we've been talking about, other week, we've been talking about different topics as they relate to diabetes. So Dr. Handel started us off with talking about what diabetes is. We talked about general healthy nutrition for diabetes and stress. We've talked about exercise. And so today we have Dr. Singh to talk about heart health and how that relates to diabetes, which is certainly very important. I'd like to remind my patients frequently that just because bacon is low carb doesn't mean it's good for their heart. So we need to keep an eye on that. So thank you, Dr. Singh, for joining us tonight.
Thank you for inviting me.
So Dr. Singh, if you can please also introduce yourself and your practice so that most of the people already know you.
Sure. Gary Singh, Delaware Cardiovascular Associates is my group. We are statewide. We have multiple offices throughout the state to serve our patients. We serve a full spectrum of cardiovascular services, and most people always think cardiology. We stop at the heart. We don't. We take care of the entire vascular system, basically from head to toe, pretty much, because that everything is involved. And we have all modalities. I think we are state-of-the-art imaging modalities. I myself in my practice like to focus a lot on preventive care, because even though we treat heart disease and vascular disease, obviously it is far, far easier to prevent than to treat, and much more cost effective and much easier on the patient in the long run if we can avoid procedures. If they need procedures, then they need procedures and we take care of it. But if we can help prevent some of this disease, we feel much more gratified. And as you can see there, in that image that's up there, the vessel on the left is clearly what we want, but very few of us have. The one on the right is what we don't want, and most of us are somewhere in the middle. We don't want it to progress to what's going on the right. So that's our objective. So the things that we like to keep in mind is that diabetics, as I said, diabetes is a vascular disease. Diabetics are much more likely to have heart attacks, to have strokes, to have congestive heart failure, and all because heart disease tends to be much more severe in diabetics. If you look at the coronary arteries that feed the heart muscle in diabetics, They tend to be smaller. They tend to be more atherosclerotic, meaning they have more plaque in them. They're more almost fragile, like eggshell-like. They have a lot more calcium in them. Sometimes makes it harder to treat, harder to even do procedures on them. So again, going back to what I was saying before, it's much better if we can catch these people earlier than later when we actually have to treat them. The other thing that we're taught from medical school on is that diabetes causes nerve damage in the heart. So diabetics are much more prone to having quote unquote silent heart attacks. So they don't necessarily have to be silent in the sense that I'm just sitting here and I have a heart attack, but silent in the sense that they don't present with the classic crushing chest pain going down my left arm sort of scenario, but rather, hey, I'm feeling a little tired. Hey, I'm much more fatigued than I usually am. Or getting more short of breath with an activity than you normally do. Oftentimes in practice, we pick up these old heart attacks on an EKG. And when we do, we go back and we speak with the patients and we question them and say, hey, look, can you recall an event since the last time we talked that may have occurred? And there's almost always something going, you know what, I had a day where I was mowing the lawn and I just kind of felt really much more short of breath, but I figured it was hot out, so I just kept going. And that was it. So not this crushing chest pain, nothing that had them call an ambulance, call 911, run to the hospital, nothing like that, but something like much more subtle, something where, hey, I'm having an off day. Hey, I'm just much more tired for the past few days. So again, for diabetics, you have to be so much more aware and cognizant of these things and not ignore them and not ignore symptoms which some people attribute to just having, as I said, a bad day, feeling tired. You know, I'm getting more tired because I'm getting older. Well, we don't get older in 6 months. We get older in 10 years. So if your exercise capacity changes in 6 months, clearly there's something else going on. It's not that you got older in 6 months. Yeah. Unless you're a physician, then you get older in 6 months. But beyond that, no. So what do we do in order to prevent? Again, let's go back to prevention. How do we make sure that you don't get to that point? Sometimes we can't do anything. Sometimes we do the best we can, yet you still get to that point. But hopefully we can catch it earlier. So one of the keys is, let's go with the basic stuff. Go get your physical exam, get your blood pressure checked, and keep that blood pressure in a certain range. Now, I think everyone has heard of the number 140/90 is where we like our blood pressure. Well, for diabetics, that's not true. With diabetics, actually, it should be about under 130/80, and ideally, about 120/80 would be perfect. So we really try to get that blood pressure down. And the reason is that blood pressure is another risk factor for heart disease, for cardiovascular disease. Blood pressure is also insidious and one of the toughest things to treat because patients tend to ignore it because they don't feel bad when they have high blood pressure. You know, we walk around with blood pressures of 160, 170, 150, and they say, well, I feel fine. You know, I don't want to take another medication. But I always use the analogy of blood pressure being a silent killer. If you can think of water dripping on a rock, well, it's just water drops on a rock. What's it going to do to the rock? But 10 years later, that rock has worn down. And that's kind of what blood pressure does to your arteries. It just wears away at them. And are we switching the slide? Okay, sorry, I saw it flip over. So no, we're not. Thank you. We'll go back to the other one. Thank you. That's it. So we're still on blood pressure. I wasn't sure if that was Kamal's way of playing the music like they do with the Oscars to play me off, but what that was. But
Well,
so anyway, that's the key with blood pressure. Get it down. Don't ignore it. There are things that blood pressure, their damage that blood pressure does that you're not aware of while it's happening. The second thing is lipoproteins. Lipoproteins, everyone thinks of cholesterol. Sure, cholesterol is important. We know that we want a certain level of your LDL, your bad cholesterol. And then when we look at that LDL, there are different types of LDL that sometimes we fractionate. We break it down into small particles and large particles. And we know that small particles tend to be worse than large particles when we look at LDL. So these are all blood tests that can be done regularly by your physician. They don't require any special preparation other than fasting. They give us a ton of information. They give us a goal to shoot for, because if those lipids aren't where they need to be, again, over time, plaque builds up and causes that narrowing that you saw in the picture before. So again, we have to be aware of those. We have to keep an eye on them, get them checked a couple of times a year. As far as blood pressure, going back, if it's within your means, or if you have some way of getting your blood pressure checked regularly other than your physician visits, if you can get a blood pressure cuff at home, if you have a friend who has a blood pressure cuff, keep an eye on it. The more frequently you check it, the better, because this way you'll catch it if it starts to go up. Physical exams are important, because with physical exams, not only do we check your blood pressure, not only do we check your heart, your lungs, your vessels, we check your circulation. We listen for the carotids. And so if you're developing some plaque in your carotids, we can pick it up early on the physical exam and do whatever's needed in order to find out, in order to do more diagnostic tests. If you're having some cramping in your legs, it may be something more severe. It may be peripheral arterial disease. And we can, again, discover that in the physical exam. When we discover diminished pulses, here we can do more testing to find out about it early and take care of it. All of this in conjunction for the patients with awareness of the signs, which is what I was talking about before. Again, it doesn't have to hit you like, wow, I'm having this crushing chest pain and I'm going to pass out. It can be subtle. As far as symptoms of coronary disease, we talked about that. It can be fatigue. It can be decreased activity tolerance. It can be shortness of breath on exertion. You used to be able to climb the stairs without a problem. Now, anytime you climb the stairs, you get winded. It can be something as subtle as that. Peripheral arterial disease. You used to be able to walk a mile. Now you walk a quarter mile or a half mile and your legs start to feel heavy or cramp up on you. That's a sign that they may be narrowing in the vessels of the legs. That's something you have to be aware of. Carotid artery disease, that's something we talked about. We can discover on physical exam. But if you have any kind of symptoms of transient numbness of the face or arm, or loss of vision in one eye for a half hour, or any of these symptoms that come and go, that could be a mini stroke, and you have to be aware of it. Don't ignore it. Say, it went away, I'm not going to worry about it. That could be coming from carotid disease or other things that could be going on with your heart. So be aware of it and don't ignore these signs and symptoms. If it is enough to concern you that something feels wrong, it's enough to tell your provider about it.
Dr. Singh, I know normally I would wait until you're done, but I have a question. When you say mini stroke and a patient may not know or they may not pay attention, can you just break that down for us? How is the patient not able to actually know, or like how can they ignore that if they have mini stroke and they're not actually taking an action?
So, as I said, if you have transient symptoms, all of a sudden, hey, my vision is blurred in one eye. It lasts for about a half hour, 45 minutes, and goes away. People, and I hear that story down the line when the patient winds up in the emergency room with a full stroke, which is what can happen because many strokes will lead up to a full stroke. Or, hey, I had some numbness in my arm. It felt a little weak for about a couple of hours, then it went away. I'm not sure what happened. We're just going to ignore that. So many strokes can be as subtle as that. But again, sometimes they are just the body's warning signs leading up to something bigger. Just as angina, which is shortness of breath or little episodes of chest discomfort or decreased tolerance, can be building up to a larger event like a heart attack. Many strokes can be building up to a larger event like a full stroke. So again, it's all about prevention and avoidance. Also, congestive heart failure, as I said, more common in diabetics. Congestive heart failure is a mismatch of supply and demand. The heart cannot meet the body's demands because of a blockage, perhaps a weakness of the heart. And at that point, you get more short of breath. You can start getting ankle swelling. You're short of breath even when you lay down at night. You can't even lay down. Those are all symptoms of heart failure. And again, it's something that people have to be aware of. I'll go back to the same thing. If something doesn't feel normal to you, you're better off asking your provider about it rather than ignoring it. So let's go back to, so these are all the things you have to look for. So how do we prevent this from occurring? And by the way, you see that, I don't know if you can see on that slide, the numbers of how many people are diabetics and pre-diabetics. And I think, Amy, you'll probably talk a little bit about that too, about the prevalence in this country. Pre-diabetes is huge, which is always the toughest thing to manage because, you know, we have diabetics, but there's so many people walking around with pre-diabetes that we don't know about and they don't know about. And the only way we know that is if they come in, see their provider, we do the blood test, and we find it. And we say, hey, let's not ignore this slightly elevated blood sugar. Let's go ahead and do a hemoglobin A1C, which will give us an idea of where things are. Especially if you have a family history of diabetes. It really behooves you to pay very close attention. But these days, as we know, we can have type 2 diabetes is so prevalent. We have an epidemic of it that you don't have to have a family history. Being overweight is a huge risk factor, and I'm sure, again, we'll talk about that too. So how do you prevent all this? How do you keep it from getting to that? But how do you keep it from getting to peripheral arterial disease, carotid disease, having coronary disease? Well, prevention. Can we go to the next slide? Thank you. Lifestyle changes. No medications, just lifestyle changes. What can you do? Okay. We talked about some of the things earlier about prevention. Let's get into it a little bit. Eating healthy, which I know Amy's going to talk about, is probably the most important thing you can do in managing your diabetes and in turn, decreasing your risk for heart disease. Stay physically active. We have a saying in my practice, movement is life. The more you move, the better. You don't have to go out and lift a ton of weights. You don't have to run marathons. You don't have to do CrossFit. You don't have to do 200 jumping jacks. Just move, just walk, just keep your body moving. Because that's one of the best things you can do to keep that blood flowing, better for your diabetes numbers, better for your heart, better for your blood vessels, and also a great way to know when something is wrong, because if you constantly move and one day you can't move as well as you did, that's your body's way of telling you something is wrong. So always move. Manage your stress levels. I always feel odd putting that in because we all know stress is not always situational. It's how we react to situations. And it's very hard to control the situations in our lives. But for me, managing stress levels to patients means sometimes just taking a few moments for yourself. And it goes back to number 2, staying active. Because if you can get out for a walk, you're managing your stress. You're taking some time for yourself, or going out with your dog. Spend some time with your pets. They'll appreciate it, and your stress level will go down. It's been proven that pets make your stress level go down. Smoking, well, if you look to the right, those are all risk factors. And obviously smoking and diabetes are the 2 largest risk factors for vascular disease. So if you need help quitting smoking, talk to your provider about it. There are things we can do to help you. Sometimes it's a multi-pronged approach. Sometimes nicotine patches aren't going to work because that'll take care of the nicotine, but sometimes it's also a psychological thing. Smoking, where people smoke, where they pick up a cigarette every time they have a cup of coffee, they pick up a cigarette after a meal. And we have to deal with that end of it too. Talk to your provider about which ways they can help you manage that. And obviously, without having regular checkups, we're not going to find any of this. You've got to go out and actually get it checked out, get a physical exam so we can pick up this stuff and so we can help you. And Obesity, obviously, that's what we want to avoid. If you can do all of this, it will go a long way toward avoiding obesity, or if you are obese, losing weight, which Amy will talk to you about also, and getting on the right path again. So not only can you live a long life, because living a long life is not necessarily all that much fun if you're not living a healthy life, but living a healthy lifestyle, because honestly, we really want to keep you out of trouble. That's really the goal and the bottom line. Thank you for your time. So
before we move back to Amy, can I just ask Dr. Singh a quick question?
Sure.
Dr. Singh, can you talk to us a little bit more about, you were looking at screening, but what about cardiovascular testing? Should there be any other testing that patients have done, like stress test or anything like that?
Sure. Thank you, Donna. The testing is really important because when you have those symptoms that we talked about, with the decreased activity tolerance, shortness of breath, the only way we're going to pick up what's going on is to do some testing. And a stress test is usually the easiest thing to do. So a stress test will pick up the fact that you're not getting enough oxygen delivery to your heart muscle because of a blockage. And the way we're going to know that is if you come into us and tell us, hey, I'm having these symptoms where I'm not feeling like I used to feel. And vascular testing, the same thing. When we check you in the office and we listen to your carotids, or we feel the pulses in your legs or your feet, we may order vascular testing if we hear something, or if we see that the pulses are diminished, or if you tell us that there is aching or cramping in your legs when you walk. That's a sign that you have vascular disease in the legs. Or if you tell us about symptoms of mini stroke, maybe you have carotid disease. And these are such easy tests to do in the office. We don't have to send you to the hospital, you know, for ultrasounds of the carotids or for the legs. There's no sharp object involved. There are no needles. There's nothing. We put a little gel on. We take a picture. It gives us a ton of information that can hopefully help you prevent further complications. Thank you.
So I have one other question since we have you, like Dr. Singh, these.
I had the same question about cuffs at home.
Sure.
So this is where I got in trouble when you were presenting. I was trying to open this up so that we can show, you said blood pressure is important, right? So now I'm looking at these, especially now with the telemedicine, and when we are trying to keep our patients home as much as possible, and we can do the same visit mostly with telehealth, having these devices at home is important for our patients with heart disease and diabetes. Now, any of these would do the work, right?
They would. You have to be careful with using the wrist cuffs, because you have to place them properly, that the sensor has to be placed on the pulse. Otherwise, people will get wrong blood pressures. And also, they have to be down around heart level. So if you can see, they should really be, you know, they should be right about here is where you should have them, right there, okay? So if you can tell where I am, so basically if you rest your arm on a counter when you're sitting and the wrist cuff's placed properly, you'll get an accurate number. But quite often, people will come in, they'll say, hey, my wrist cuff's not working, I'm getting different numbers. When we show them how to use it properly, the numbers pretty much match up. The other thing that I will say is that if you're not sure if your cuff is right at any point, call your provider, say, hey, you know what, can I get my cuff calibrated? So you'll come in, get it checked, we will check in the office. And if it's off by 5 or 10 points, we'll say, well, you know what, keep using your cuff, but adjust. Add 5 points, subtract 5 points, or something like that. But thank you, Kamal. That's so important. It makes such a difference to us if you can do home monitoring, because we can keep a much closer eye on you and help you prevent things.
Well, good. I had the same question because I have a lot of people who have a history of high blood pressure. They they've been having more headaches. Their diet, they know they're gaining weight, but they're afraid to go in and not say, well, can you use your cuff? And they say, well, I don't know if it's accurate. Does it need to be calibrated?
Right.
So that's a good tip. Thank you.
Yeah, we do that quite frequently, actually. We just have people come in the office when they call us with numbers, and the numbers don't sound right, or they're high, they're worried about it. We say, you know what, don't worry, just come on in, let's check it for you. We'll even check your cuff, bring it in, and bring in a log of your blood pressures, and let's go through it with you. And we do that on a very regular basis. And once we know it's accurate, the beauty of it, as Kamal pointed out, is now with telemedicine, we can just do that without them even having to come in. We can just go over it with them and work it out that way.
Okay. All right. Are we ready for nutrition?
Yes.
Always ready for nutrition.
Oh, good. Well, thank you. So, Dr. Singh, you gave me a lot of credit of things that we're going to talk about more in November, and we're going to talk about tonight. Tonight, I limited it to really more heart-healthy diet. In November, we're going to talk more about prevalence of diabetes and specifically about weight management with pre-diabetes. So my talk is a little bit smaller tonight, particularly about food for heart health and obviously for diabetes, also particular food types. But Dr. Singh did point out that the prevalence is huge. Diabetes is the 7th leading cause of death. There, I think by the year, when I was in grad school, almost 20 years ago now, the statistic was by 2030, 1 in 3 people will have diabetes. And I think with pre-diabetes, we're definitely there. And in 10 years, we're not going to be there. But from what we see, we might be. And like Dr. Singh said, prevention is really, really important. I like to talk about with food, especially the early diabetes prevention program before it became for pre-diabetic patients. It was a CDC study where they compared medication to diet and exercise, and diet and exercise lowered A1C more than metformin did alone. And so if you could do all this work on your own, which is cheaper than medicine and it's safer than medicine, and your arteries might not look so bad, like the pictures Dr. Singh was showing, why not do it now? And why not start it when you're young? And Dr. Singh, I could appreciate what you were saying. My father was a runner, well, actually he's more walking now, he's 76. But at 49, he had chest pain while he was running. So he went in, he did not have a heart attack, but he had a triple bypass the next week. So now at 76, he's still very active, a couple stents and later for some bad behavior, but he's doing really well. So it's something in our family we take, and you could be watching this, and I'll say hi to them for that. We take heart health very seriously in my family because of that, because we do, even though my numbers are good and I'm a runner and I eat healthy for the most part, we take it seriously because we do have that risk of knowing that. So I'm glad that you brought that up, always paying attention and staying active. And so I'm going to talk about foods specifically that raise cholesterol. We've talked a lot about triglycerides with patients with high blood sugar because some of the same foods raise triglyceride. And some of the diets that are very popular, we will see high triglycerides with that. So we want to limit foods that are worse for your heart and your arteries and vascular system. And we want to increase foods that will promote a healthier system and promote better blood flow. So I could have the next slide, please. Thank you. So starting with the foods that are going to cause more damage. And right now the keto diet is really big. I probably once or twice a day I have a person who says, I'm losing all this weight on keto. And then their cholesterol comes back and their LDL is 230 and their triglyceride is 400 or 500. So I look to see, yeah, you've lost weight, but you're not so healthy. So can we come to a happy medium with that and have a nice low weight and have nice healthy numbers? So we know that saturated fat can increase plaque in the arteries. And so this is fat from animals and some tropical oils, so whole milk dairy, cheese, the skin that's on the poultry, red meat such as lamb, pork, and beef, foods like ice cream, chocolate, butter, fried foods, shortening, palm oil, and ghee. Doesn't mean that you can never have these foods because there is quality of life, but ideally when we talk about the foods to increase, you want to have more of those other foods in your diet. Refined carbohydrates, so think about grain, not an intact grain. So if you think about something that's been milled down, if it's a white flour product like a pretzel, back in the 80s, 90s, pretzels were big because they were fat-free, but they're white flour. So all the nutrients have been stripped. Blood sugar goes up quickly from them. and so does triglycerides. You have a lot of fat in the blood when you're eating a lot of foods like that. So bread and crackers and pasta and pretzels and pancakes and waffles. So you get the hint from there, white rice, sugar and sugary foods. And we do see high triglycerides from alcohol, which I don't have on there also. But those are foods that are not going to help create good circulation. So you don't want to have a lot of them in your diet. I'm not going to tell somebody that they can't have any pasta at all because it doesn't really seem very fair. You can, but we want to limit some of those foods. And you'll see some false, I don't want to say false labeling, but you'll see different claims on boxes. So we can see Cheerios here, and it says right on there, I'm trying to see how I can help lower cholesterol. Now, these are regular Cheerios. It would have been better if I had gotten the Honey Nut so I could show, which it has the same label on them, but Honey Nut is full of sugar. So do these help lower your cholesterol? Well, they're made out of oats, but oatmeal would be the better product because it's not as refined as this. So now I do have another product I'm going to throw off in here. So this is red lentil pasta made by Barilla. So again, is this better than white pasta? Yes, it has protein and fiber in it. But is it better to eat the lentils themselves? Absolutely, than to eat this. So can I have the next slide, please? Thank you. Oh, thank you. So foods to increase, what is going to help lower your cholesterol? When you eat soluble fiber, and that is where this claim comes from on this box, this is soluble fiber. Soluble fiber binds bile, and when you excrete that bile is made out of cholesterol. So it helps you lower the cholesterol, which is why every food with oatmeal, anything that has soluble fiber can make that claim and not get sued. So Honey Nut Cheerios, even though it has sugar, can technically make that claim. But we would rather you have intact grains. So ancient grains like freekeh, bulgur, quinoa, farro, and then foods high in soluble fiber. Half your plate should be vegetables. It's true. Sometimes when people come in and they want this magical diet, and I tell them to eat, 2 cups of vegetables with their meal, and they think, oh, it's so boring. There's something else that I can do. No, you have to find vegetables you like. Try roasting them, try grilling them. I discovered tonight that I could put frozen fish and zucchini in the Instapot and it cooks in 2 minutes, and it was magic, and it was good too. So finding new ways to cook can maybe make it exciting for you. And when I used to work with picky eaters, finding there's 3 or 4 vegetables you're willing to eat and stick with those if that's all you can do. Unsaturated fat can help improve cholesterol when used in place of saturated fat. So instead of putting butter, trying avocado. Instead of doing cheese and crackers, try eating hummus. Using fatty fish in place of beef. Using healthier oils, olive oil, canola oil, using peanut oil. You do have to pay attention. Some people come in and they say, oh, well, I switched. I don't use palm oil anymore in my stew. I now use canola oil. But they're using a half a cup of oil, which is 100% fat. So now they have all this excess calories from fat, which is not helping their weight. So while they're adding in the good fat, it's still not as good for them. So we want to try and see where can you put these foods in. So if you're eating white toast with butter for breakfast, could you do wheat toast with peanut butter? Again, if you're doing cheese and crackers, would you be willing to eat sardines? Which is something some of my patients turn up their nose, but some say, oh, I haven't had those since I was a kid. Because we know they're a little fish. So in terms of safety with contaminants, they're little, so they haven't eaten a lot of fish. So tuna is a really big fish. So it has more contaminants because it lives a long time and eats a lot of fish. So including those different types of things in your diet. Can I have my next slide, please? Thank you. So for optimal heart health, make half your plate vegetables. So one of the things that we start with the very early on, and people will say, to Dr. Singh's point about prevention, they say, well, I've never had high cholesterol. It's never been a problem in my whole life. Well, we don't want to make it a problem. So let's eat like it is a problem and keep your food really healthy instead of saying, well, I think I can eat all of this high fat. I can eat McDonald's every day because I'm not worried about my heart. But I don't want you to be worried about your heart. I want you to stay healthy because prevention is so important. So are you eating vegetables every day? And a lot of times people say no. So I think of vegetables, you know, it's like brushing your teeth. It's like washing your hair or taking a shower or things that you have to do. In my case, feeding the cat. You have to eat vegetables every day. They're part of necessary health. You should be eating fruit every day. So 2 to 3 servings of fruit every day, 3 to 4 cups of vegetables every day. And then occasionally putting in a meatless meal. So trying a meal that is familiar to you. So if you're somebody who likes to eat burritos, try putting beans in instead of meat and see what you think. Try using a marinated tofu instead of chicken or beef or pork in a stir fry. Putting beans in instead of beef and chili, and see how you feel about that. That's going to cut your saturated fat for the day. Sometimes people will say, well, I'm going to try and have a meatless breakfast and lunch, and not have, and then just have that more saturated fat for dinner. A lot of people feel when we talk about protein and having the protein for meals to balance your blood sugar, they think, well, I have to have meat and I have to have bacon and sausage and scrapple for breakfast. And that's one of the things, there is no healthy breakfast meat. So what else can you eat for protein in the morning? So can you put in some nuts? Can you put in some seeds? Can you try avocado toast? What else can, well, an avocado is fat, but what can you do to balance your blood sugar instead of thinking, oh, I have to have that breakfast meat? We have a lot of breakfast meat eaters, and we'd like to see less, ideally, in there. I think that it may have been my last slide. Oh, good.
So we are going to have some of the questions we kind of already asked. I'm going to actually stop sharing my screen here, so then they can see all of us a little bit bigger. So the question, like, it's not on the list, but I do, when I actually brought up the blood pressure monitor, what would be the ideal situation for a patient with diabetes and heart disease, hypertension, all those together? Like, what should they have at home in terms of devices, like that would help the physician and dietitian if they're able to monitor? We know that blood pressure should be, but what else is available there?
A scale would be great. A scale and a blood pressure monitor really go a long way. Blood pressure monitors usually give us pulse also, which helps a lot. And they will let us know if there's an irregularity of the pulse quite often, so we can pick up problems early on. Amy, I don't know if you want to add anything.
What's the one that actually goes
to
your
pulse oximeter? The pulse oximeter, yeah. Yeah, and those are important because they'll give you them oxygen saturation as well as a pulse. So that'll help also, because those are all things we check in the office. So the more things they can do at home, it'll make it more akin to an office visit. It gives us more information. So sure. And you can actually get those at a pretty reasonable price now. You can get them off Amazon for about $24 or so, I think, the pulse oximeters.
So one of my concerns, and as we do these events more and more, part of the reason we do these events is because of the diabetes program, but the other reason we are doing it in this format so that we have more support for patients who are going through the time that we are dealing with the pandemic. And the telehealth, telemedicine is going to be the future of medicine. And I want our patients to understand this very clearly, so that while we are working with our providers and our offices to educate them or support them rather with the technology and make this more seamless, we need patients to take care of themselves and help us with the monitoring. In some cases, Dr. Singh, like in the bariatric program, we have patients who don't own a scale, and the BMI 48, 54, 58. I'm like, what do you mean you don't have a scale? Like, this is, you know, you have to have it. It's $20. So, so if we can maybe put something together for patients to own at home to help, not necessarily eliminate the office visits, but helping us to transform those visits to telehealth, so that providers can actually make those decisions in a better way. Now, we have a couple questions that we posted out there. Donna, if you want to take one of them.
Right. So I think one of the questions we had, Amy, was, can you take a fiber supplement? So is that something that would be beneficial?
So Dr. Singh, I don't know if you want to answer. I mean, I usually will say no because yes, if you're having trouble with constipation, but for heart health, the fiber supplement is not necessarily a naturally occurring supplement. It's a manufactured fiber, so you're not going to get the same benefits from plants. And that's something I hear from my keto patients because I say to them, the people who live the longest in the world eat fiber. They eat fruits and vegetables and beans. And they say, well, I just take fiber gummies every day. I'm covered. It doesn't count. So I would say for heart health, no, it doesn't cut it. And Dr. Singh, I don't know if you want to add to that.
Well, I think that what happens, a lot of people who do a primarily keto diet or a paleo diet quite often do have issues with constipation. It's something that's not talked about much in the keto community, but it does happen. Mm-hmm. And I think for those patients, absolutely, a fiber supplement would help them in that regard, as you pointed out. But it does not replace eating an apple, eating a banana, having oats, the other thing you were saying, because that's much more beneficial and obviously a far better way to get your nutrients than take them in a supplement form.
Mm-hmm.
So one of the questions, Dr. Singh, this is probably for you. Patients with diabetes and cardiovascular diagnosis, how often should the patient see a cardiologist?
I think so. I'm going to digress a little bit and talk about a study that was done about, I think about 12 to 15 years ago in the UK. And it was a really, really fascinating study because they looked at the incidence of heart problems or cardiovascular events, as we call them, in two groups of patients. They looked at patients who were diabetics but had no pre-existing cardiac disease. And on the other hand, they looked at patients who were non-diabetics but had known cardiovascular disease, had bypass surgery. And they followed them for 5 years to see who had more cardiovascular events. Obviously, you would expect the group that already had heart disease to have more cardiovascular events. The incidence was equal. So for cardiologists, diabetes equals coronary heart disease. So if you're a diabetic, you're at higher risk. So I think if you're a diabetic, at some point along the way, you should see a cardiologist because it is a vascular disease. It's not just a disease of blood sugar. When you should see them? Well, when you're first diagnosed, obviously our goal at that point is to get your blood sugars in order. But I think soon after that, within a year after you're diagnosed, you should at least have a visit with a cardiologist, talk about prevention, because even if it was diagnosed at time X, diabetes may have been present at X minus 2 years and we just didn't pick it up. Or you may have been pre-diabetic for 4 years prior to that and it wasn't picked up. So you've had all that time to accumulate damage. So I think within the first year of being diagnosed, you should be seeing a cardiologist. At that point, the cardiologist will make the determination of whether further follow-up is needed or how often it's needed.
So there was one other question. If someone's cholesterol is normal, so I didn't write this question, is it okay to eat a lot of red meat? So
okay.
It's not my question. Normally I have that.
Again, normal cholesterol is a funny word because normal cholesterol for someone who's an otherwise healthy person with no diabetes, no high blood pressure, nothing else, the cholesterol level we're willing to accept for that person is far different from someone who has hypertension, or someone who's a smoker, or someone who's diabetic. And normal cholesterol is again a funny number because we look at LDL, we look at HDL, we look at ratios, we look at so many different things. So my answer to that would be that regardless, red meat in itself is not something that you absolutely cannot eat. However, keep in mind your family history. Red meat affects everyone differently, depending also on your ethnicity, culture, and background. You may be able to tolerate red meat better than the other person, than someone else. So I would say, just like anything else in life, moderation is the key. And find out what your doctor or your provider, whoever told you you had a good cholesterol, actually meant by that.
And I would add add that we know that red meat, you have a higher risk of colorectal cancer. So if you have colon cancer, history of that in your family, if you've had a history of polyps, that's something you'd want to be careful with.
Thank you. Excellent point.
I did want to bring up the Million Hearts research program that we have through Medicare. United Medical ACO is part of this, and I believe we are the only group in Delaware. Dr. Singh, we work with the central office with our care coordinators, and we work with the providers very closely. Does it have? How does it help you guys, or does it help with the patient management from the cardiology side? And do you see a lot of diabetes for those patients in that group?
We do. You know, we always get the pop-up saying this patient is a Million Hearts patient or is eligible for a Million Hearts program. And I don't know if we necessarily are treating the patient any differently, but it does give us a heads up to say, hey, you know what? Let's perhaps bring this patient in and talk to them a little bit more about this, so they're more aware of what's going on. And these days, especially with telemedicine, I think it's great because, as I pointed out on the last time we talked, we can talk to the patient much more frequently. It's like it's not a big deal for them to have to come to the office every 6 months or so. If we're unsure about something, if we think of something, if we say, hey, you know what, we need to have a couple of these screenings done because you're eligible for this, because you fit in this program, we can just pick up the phone and say, hey, let's talk. Or we can talk like this over video and say, hey, you know what, let's look at your blood pressures, let's look at your weight, let's have you come in and do X, A, B, and C. So I think in that sense, it's helpful. I think telemedicine is a perfect adjunct, as a matter of fact, to that program.
All right. Do we have any other questions?
I don't have any other ones.
All right. So, Amy, Dr. Singh, thanks for joining us.
Thank you.
I think this is really important for us to be able to support the patients who are struggling with these heart and diabetes issues, along with a lot of other problems. And if we can be we can help them and make this a little bit easier. That's our goal. And please let us know if there's anything else we can do. We have these events, the diabetes events, twice a month. The next one is going to be the second Wednesday of October. And hopefully we'll see everyone at that time. The video will be available offline on our YouTube channel and other social media channels. So please take advantage of these as much as possible. Thank you so much. Have a good night.
Thank you, guys.
Bye-bye.
Good night.
Thank you.
Bye-bye.
Bye.